This is Ryan Hoyme, AK Massage Nerd. And today we have Don McCann. Welcome.
Thank you.
So tell me a little bit about your business then.
Okay, well, structural energetic therapy evolved because after I was trained in massage 35, 40 years ago, actually, quite a while ago.
Yeah.
Anyway, I found that my clients were coming in and they had very specific problems. And I was really concerned to have them rehabilitate, get out of pain and resume life. There were some major issues. One, I've been trained in a 10-session body restructuring, deep tissue myofascial work, which I thought was very good, but my clients didn't fit that picture when they came in. What was happening was they would have like a herniated disc in their neck, or a bulging disc or stenosis in their low back, or a knee injury, or a neck TMJ problem. And some of these issues wouldn't be addressed until 7 or 8 sessions down the way in this restructuring of the body, and even then it wouldn't be addressed directly. So the first paradigm I saw was I needed to develop a structural support restructuring that we could look directly at the area of discomfort and pain to work on rehabilitation. Because I saw that the clients weren't getting treated in the area of pain. They were kind of like, why am I doing this? Or am I ever going to get better? So the whole concept of myofascial unwinding had different levels that you work on at different times. So there's some pretty big challenges to get by that. I started searching a lot. Came to SOT chiropractic concept of balancing, bringing the iliums into balance and bringing the sacrum, leveling it out so the whole spine would start to unwind. Well, at that point I could either apply a soft tissue protocol in the low body for the pelvis or the head, neck, and shoulder. We were on the way. Ultimately what happened though was, no matter what we did, that SI joint relationship to the ilium would start to give out again. When that happened, they'd be back in the pain syndromes. And the problem for the disc we could maintain, but we couldn't get to where it was maintained without treatment. So that was a continual search. I went and started studying cranial osteopathy, craniosacral, all the different cranial things. And there's something kept on talking to me there. One of my teachers drew a relationship between the wings of the sphenoid and the ASISs of the ilium and the ridges of the occiput and the PSISs. And he's kind of pointing out that everybody's got this distortion up here, but they've also got it down there. Well, I knew about the distortion in the soft tissue and the structure, but I didn't know about the cranium. So one of the first tests we came up to show that was if you open your mouth wide, it's an exaggeration of the distortion up here, and it's basically a TMJ dysfunction. And it would test weak. Well, this guy was working on clients, and I was working on clients. He was a chiropractor. He would treat somebody, and then they'd come in and they'd start to maintain from the work I was doing. And some of these people were people with some really severe injuries that I never thought they were going to maintain. So I was over there, tell me more, teach me more, and he opened the door of what he developed. Well, he's a chiropractor, so he's looking at chiropractic concepts. I'm a massage therapist, body restructor, looking how we can go ahead and work the soft tissue. So we kind of diverged at that point. But what I came up with was, if we can take this distortion out of the cranium, it brings the iliums and sacrum into weight-bearing support.
Okay.
So this had not been done before. There was a weight-bearing support no matter what. That really freed me up to work anywhere in the body once this had been done, and the rest of the body was going to support the changes. And we had a structure to rehabilitate from too. This was different than what had been done out there before.
Yep.
All of a sudden, I'm a kid in a candy store.
Yeah.
I've got clients going, oh man, look what I can do. Oh wow, look what this is.
Yeah.
And we were at the tip of the iceberg at that point. We had one part of this cranial, which we have since named cranial structural therapy. We had one little piece of it, and that was the torsion of the cranium. As we unwound that, what we discovered was that everybody rehabilitated out differently. And there were like 20 different sub-patterns that people would go into after the core was released. But what was also interesting is I've yet to meet someone that's not in the core that hadn't had a correcting. So it appears that we're born with this core. And that brings up questions, did it come from birth? No, because we've seen fetuses that are 16 weeks old that you can already see this core, this rotation of the iliums developing in. You can just see the iliums already off. I don't know why, but I do know that if we bring it into balance, there's weight-bearing support. So the rehabilitation is sort of changed. We can, in one treatment, unwind this distortion out of the cranium, this will become weight-bearing support in the iliums and sacrum. The spine will straighten out, be more support to the body. And amazingly enough, we've had people go to really severe auto accidents, falling off buildings, rolling down mountainsides, and they still don't come back in this core distortion. So this is like, it's amazing for the recovery for people. I teach courses in it. We've applied it into autism. We've applied it for concussions, people with concussions and different things, and having some amazing results. In fact, I'll be speaking at the convention. One of my presentations is going to be on autism and learning disabilities, and how when we unwind this, the possibilities that open up for the different function, not only physically but also mentally, takes place.
And what other, is it similar to craniosacral then, in a way, in your style?
Well,
or
the big question here, craniosacral, the cranium is governed by, and the bones, like all bones and joints and sutures, are governed by the soft tissue around it. The range of motion is governed by soft tissue. And craniosacral works within those myofascial or fascial or reciprocal tension membrane restrictions. This is going to take the cranium to the range of motion and hold for like a myofascial release. So we're actually unwinding it beyond that.
Okay.
So where craniosacral is going to work with 5 grams of pressure to stay within that, here we're going to go way beyond that. I've talked to a number of old osteopaths that have been practiced for years with the cranial work. And I mentioned the 5 grams, they kind of snicker to the side and they say, I've never measured 5 grams. I said, well, show me what the pressures you use. And what they're using is pressures enough to meld through the soft tissue to hold the bones.
Okay.
To hold where they want to hold. And then the pressure to actually move the cranium is very light. But when you come to the restriction, you've got to hold with enough pressure to go ahead, like a myofascial release, to allow the tissue to unwind or release. So that it's much different. You can't get there with the volatile from craniosacral because you're not moving with enough pressure or enough range of motion to get it there. Also, we're not waiting for the cranium to move and just stay with the pattern. We're moving it. We know these directions that the cranium is going to move. We know what the flexion and extension of the cranial motion is. So we can take the wings of the sphenoid and the occiput and move it to that range of motion and then hold. Rather than, is it going to go there or we're going to feel it? We're going to actually move it because that's the range that's already existing.
And what can we see from you in the future then?
Well, what can we see from me in the future? My whole thing right now is about training. I've been successfully in practice now for 36 years. I have a practice that's booked out for a year in advance. I'm trying to get as many children in now. My whole thing right now is expanding into children with special needs.
Okay.
I mean, I can give a lot of very interesting case studies on children, but the whole concept is if we can catch children before the fascia sets up so much, the cranium has much more potential for unwinding. When children are in the core distortion, they're all born in that, and they have inherent weaknesses in their body because of the alignment and the muscle-energy relationships. And when I can take a 3-year-old child and take this core distortion out, they now no longer have those. So their ability to develop, manipulate their environment is dramatically increased. They're stronger, they're more coordinated, they're more flexible. And basically we're seeing they develop much quicker and basically pretty much at the head of their class or gymnastics or whatever they're doing. The other thing is without the weaknesses, they're not going to have the injuries they would have had. So they're also not going to have the backdrop on the injuries where they're being lesser rather than more based on the injuries. So we've seen some really amazing things. My granddaughter, first person I wanted to work on. I wanted to give her that opportunity. But there have been many, many I've worked on. A lot of the children I've worked on, especially infants, are brought to me because they have problems. Very common ones, torticollis, where the head will only go one way and won't come back around. Most often, they are a forceps delivery. And as soon as I hold that cranium and feel the sphenoid area, there's an indentation or a jamming.
Okay.
As soon as that releases, the head comes right around. It's like the first time I did that was a 3-week-old baby, and the father was an osteopath. They brought this child in. The father, being a good doctor, had his child scheduled for surgery at 6 months, where they were going to cut the tissue and reattach it to give a range of motion of her neck. I had the child on my table, and I'm going to hold this little head that's more cartilage than cranium and then bone. And I take hold of that, had the child turn the head, the mother went over to one side and the baby turned fine, had to go to the other side and the child hit this midline and couldn't get across it. I took hold of that and started working with the cranium and the motion, and now there's almost like it was a divine intervention that the information came to me about how to work with that soft cranium. But as I'm working it, there was an indentation from the forceps. As it filled out, after about 5 minutes, it felt normal to me. So I told the mother, okay, now I want you to go ahead and we're going to check again. And she looked at me and said, well, you haven't done anything yet. So just humor me.
Yeah.
Just humor me. Just go ahead and let's see what happens. So she goes to one side and Brandy was the girl's name. She turns her head this way and she goes to the other side and her head came right around. Well, I was chilled, they were chilled, everybody was like shaky at that point because we didn't know what to expect when I started treating when we saw that. So from children to athletes, the strain patterns that athletes have are incredible. Performance-wise, it limits them dramatically and sets them up for a lot of injuries. And most athletes that are halfway accomplished have had a multitude of injuries. So it's a downward spiral with the injuries and they get further into distortion. The core distortion can bring them into weight-bearing support, which immediately makes a difference. And certain muscles, that, like hamstrings on the right posterior side of their body, are very weak, and the quadriceps on the left. Immediately seeing the change in strength on those just amazes them. Baseball pitchers, we can show why they get their rotator cuffs, because those are the weakened strain patterns that get torn. As soon as we do this, even though they still have the tear, they're able to throw that pitch back to where they were before.
Yep.
So there are many pitchers out there right now that have rotator cuff tears that are out there pitching better than they did before they had the tear because they had treatment like this that brought the strain patterns out.
And what's the best way for people to get a hold of you then?
The best way is www.structuralenergetictherapy.com.
Okay.
Our website is a very effective way to reach us. Other way, well, get other contact information off that because, like I say, call me, but I'm so busy right now, that's really the best way to reach me.
Yep.
I'm booked like 8 in the morning till 8 at night.
Okay.
And plus, I'm writing another book.
But you get treatments yourself then, right?
I still give treatments myself. Absolutely, give treatments myself. It's like it's just too rich not to. I get too much out of it.
Yep, definitely. Well, thank you very much, Don.
Thank you very much.
It's a pleasure. Thanks, everyone.
Thank you.